The goal of the Human Rights Now New York is to share the voices of local citizens in underrepresented communities in Japan so that their voices will be heard in the international community. We have been organizing events in the past about a year to raise awareness on the situation in Fukushima by inviting guests from Japan to talk about some of the ongoing serious issues after the nuclear disaster in Fukushima. March 11, 2011 was a wake-up call for all of us. Before March 11th, Human Rights Now mainly focused on human rights situation in other part of the Japan. We didn't mainly focus on the domestic issues. But after March 11th, we established the earthquake relief project in order to raise awareness on the situation in affected areas whose lives and health were affected because of the disaster due to the earthquake, tsunami, and the nuclear accident. More than a year and 8 months had passed since the March 11th, which caused enormous damage to the Japanese community. The nuclear accident in Fukushima continues to threaten the health of people, health and lives of many citizens, including children. It is estimated that over 20,000 people more than 20,000 people passed away due to the earthquake, tsunami, and aftermath of the disaster. Our thoughts and sympathies are with those who lost their families, friends, and loved ones, and also who are still suffering from the ongoing crisis. After the nuclear disaster in March 2011, local communities in Japan continue to be exposed to radioactivity. Many citizens still live in an area where radiation level is dangerously high. The Japanese government continues to keep the citizens in harm's way because they designated the evacuation zone based on the 20 millisieverts per year in order to establish evacuation zones. And there are serious concerns on children's health in affected areas. However, sufficient health investigation or health exams are not conducted in affected areas. And the right to access to medical treatment, as well as the right to know about one's own body, has been seriously denied. Let me explain to you some of the health-related issues after the nuclear accident. Starting from October 2011, children who reside in the Fukushima prefecture are subject to thyroid exams. During the October 2011 and the end of March 2014, thyroid exam will be conducted to those children who are 18 years or younger as of March 2011. There are about 2 million people living in Fukushima prefecture, and 360,000 citizens are considered as eligible for this program. So as you can see, infants who are born in April 2011 or later are not subject to this exam. And adults who are older than 19 were not subject to the exam. Children or adults living outside of Fukushima prefecture who are also affected by the fallout from the nuclear accident are not subject to the exam. And the health exam should be provided to those who are residing in the contaminated areas, not just this limited groups. So first, thyroid exam will be provided during October 2011 and the end of March 2014. So it is possible that you won't be, you are not having the thyroid exam, first thyroid exam, until almost 3 years after the nuclear accident. And after April 2014, thyroid exam will be conducted every 2 years until the child turns 20 years old, and every 5 years after that. It means that the thyroid exam is not provided every year, so you'll be provided only once every 2 years. until you turn 20 years old. And other health exams such as blood tests or urine tests are not conducted, except to those who are subject to secondary exams due to the size of nodules, which is larger than 5.1 millimeter, and or cysts, which are larger than 20.1 millimeter in their thyroid. So if your children were found with nodules or cysts smaller than the standard, then you won't be able to receive any blood exams or urine exams or other type of exams. There are also other issues related to the health-related health exams and the healthcare system provided to the children in affected areas. Copies of children's medical records are not released to them or their parents unless official information disclosure procedure is taken. So if you're a parent and if your child has the first thyroid exam and found with the nodules or cysts, which are smaller than the certain size, then as a parent, you might want to ask for other doctors for second opinion, or ask for more exams, or might seek treatment even though it is not larger than, for example, 5.1 millimeter in terms of nodules or 20.1 millimeter in terms of cysts. However, children and their parents cannot access the important information about children's health condition, even if some abnormalities are found. Ultrasound images of the thyroid exams are not disclosed as of today. Recently, there was a report that a professor of the Fukushima Medical University, who is conducting and supervising this thyroid exam for children in Fukushima, said that they are going to consider releasing the ultrasound image of the thyroid exam. But as of today, that kind of disclosure is not happening in Fukushima. And also, there are reports that many doctors refuse additional exams and an opportunity to ask for second opinion, additional exams or treatment is deprived. So under this circumstance, what can you do as a human rights organization to protect and promote the human rights of citizens in affected areas? Options are very limited, but there are two recent developments regarding to the health-related issue in Fukushima after the nuclear accident. One of them is the Universal Periodic Review. Universal Periodic Review, it's also known as UPR. It's a unique process which involves a review of the human rights records of all 192 UN member states, meaning that 192 countries affiliated with the United Nations, once every 4 years, in order to review the human rights situation of the country. This process was created in 2006 when Human Rights Council, which is part of the subsidiary body of the United Nations, was created. And no other universal mechanism of this kind exists. However, it is not legally binding. The goal of the Universal Periodic Review is to improve the human rights situation in every country. And who is going to conduct the review? The UPR Working Group, which consists of the 47 members of the Human Rights Council. And how are they going to review the human rights situation in a certain country? These reviews are based on information provided by the country through national reports, reports of independent human rights experts and groups, and other stakeholders, such as information provided by the non-profit organizations or non-governmental organizations or grassroots organizations, such as human rights organizations. And NGOs can attend the UPR Working Group sessions and can make statements at the regular sessions of the Human Rights Council when the outcome of the state review is considered. Regarding the Universal Periodic Review of Japan, Japan was reviewed for the first time in 2008. The UPR process was established in 2006 for the first time, and 2008 was the first time when the Japan was reviewed. And the second review was conducted on October 31st, 2012, which was just last month. by the UPO Working Group of Human Rights Council in Geneva. On November 2nd, 2012, the draft report of the working group on the UPR of Japan was published with 174 recommendations. And these recommendations are related to the human rights issues in Japan. And it does not necessarily related to the disaster or the nuclear accident or aftermath of the nuclear accident. It includes all kinds of information, all kinds of recommendations, including the comforting women issues and so on. So conclusions and/or recommendations in the report included 174 recommendations formulated during the interactive dialogue and listed in the report will be examined by Japan, which will provide responses in due time, no later than 22nd session of the Human Rights Council in March 2013, meaning that based on this report, Japan has to respond by March 2013, which is about 5 months from now. Out of 174 recommendations, there was only one recommendation regarding Fukushima nuclear disaster. That was 155th recommendations in the report, which is also published and available on the internet. And the recommendation of 155th recommendation said, take all necessary measures to protect the right to health and life of residents living in the area of Fukushima from radioactive hazards and ensure that the special rapporteur on the right to health can meet with affected and evacuated people and civil society groups. Austria. What does it mean? It means that it was recommended by the country of Austria. So some of the recommendations are recommended by other countries for other recommendations, and this particular recommendation was recommended by Austria. So based on this report, Human Rights Now requests the Japanese government to accept all of the recommendations included in the report, take all necessary measures to implement the recommendations in order to improve the human rights situation in Japan, and finally, ensure that the UN Special Rapporteur on the right to health can meet with local citizens in affected areas and civil society groups during his visit to Japan from November 15th to 26th, which is happening now. And he arrived just yesterday to Japan, and he's visiting a couple of cities while he's in Japan. Separate from the UPR process, there was another venue that civil societies pursued in order to raise awareness on the situation in Fukushima after the nuclear accident. And that was inviting or asking UN Special Rapporteur on the right to health to visit Japan in order to conduct independent and unbiased investigation on the health of people after the nuclear accident. So what is UN Special Rapporteur? They are independent experts appointed by the Human Rights Council to examine and report back on the country's situation or specific human rights theme. The position is honorary, and the expert is not a staff of the United Nations, nor paid for his or her work, although the expenses for the country mission will be paid by the United Nations. He or she expresses his or her view in an independent capacity and does not represent his or her government. He or she represents annual reports to the Human Rights Council and to the General Assembly. So what does the United Nations Special Rapporteur on the right to health do, or does? Special Rapporteur on the right to health will gather health information from all relevant sources, including government officials, government agencies, local people, representatives of civil societies, and other people who are important to gather the information to understand the whole picture of the situation. He also communicates with all relevant actors, including the government, UN bodies, agencies, particularly WHO, World Health Organization, as well as non-governmental organizations. He also reports on the status of the right to health, including laws, policies, good practices, and obstacles. He also submits reports to the Human Rights Council and the General Assembly on its activities, findings, conclusions, and recommendations of appropriate measures that promote and protect the right to health. So who is the UN Special Rapporteur on the right to health? His name is Mr. Arnold Gruber. He is the Special Rapporteur on the right to everyone to the enjoyment of the highest attainable standard of health. It's also known as Special Rapporteur on the right to health. He'll be on the country mission to Japan from November 15 to 26, and he will visit Tokyo, Fukushima, and Miyagi prefectures and meet with all stakeholders in Japan. He was appointed by the Human Rights Council in 2008. And he is a practicing lawyer and handled several hundred HIV and AIDS-related litigations in India. So once again, he's an independent expert, not affiliated with the United Nations or subsidiary bodies. And he's going to make independent and unbiased assessments based on the information gathering in Japan. And he will make the reports and with recommendations based on that assessment of the information. And we are expecting that such recommendation will be published by no later than June 2013. So, Universal Periodic Review also takes time to receive a response from Japan. Because Japan is asked to respond by March 2013. And also the recommendation by the Mr. Gruber would not be published until next summer. So it's a long process, and both of those processes are not legally binding. So how are we going to protect the rights of people, especially the right to health and life of people in a contaminated area, because they need immediate assistance. They need immediate attention from medical communities and civil societies, because what's going on in Fukushima is an ongoing crisis. My presentation will end right here, but we'd like to ask Ms. Kazuko Kawai to share some of the information that she gathered when she was in Japan. And also she's going to report the health-related forums and health consultations that she organized with Japanese medical professionals, as well as the foreign doctors representing Physicians for Social Responsibility, as well as the IPPNW Germany. We're not medical professionals or scientists, but we reviewed domestic law in Japan as well as the international standards soon after the nuclear accident. And before the March 11, 2011, Japanese domestic law of the radiation exposure dose for general public was 1 millisieverts per year. And after the accident, the government raised to 20 times to 20 millisieverts per year in order to designate evacuation zones. So now people are in contaminated areas exposed to dangerously high-level radiation, which are not allowed in pre-catastrophe standard. And also in Japanese domestic law, it prohibits general public to enter radiation control areas where the radiation exposure dose is 5 millisieverts per year. And in radiation control areas, only nuclear workers are allowed to enter, and general publics, as younger than, for example, 18, are not allowed to enter. You're not allowed to eat there or smoke. Now, people are living in this kind of environment where the radiation exposure dose is more than 5 millisieverts per year, and they're living there, they go to school there, they are eating and having a normal life, because Japanese government failed to provide proper guidance to its citizens regarding the potential risks associated with the radiation exposure soon after the nuclear accident. And also, there was a strong campaign in Fukushima to downplay the danger of radiation exposure by bringing those scientists, such as Dr. Yamashita, saying that the radiation exposure dose is lower than 100 millisieverts per year, then it's safe. Or no evidence of physical harm under 100 millisieverts per year, or no immediate harm, or stress is the most harmful to children. So, and also, even if when you were a female and also a nuclear worker working in radiation control areas, and if you're pregnant, you're not supposed to be exposed to more than 2 millisieverts per year during the entire pregnancy. So 2 millisieverts per year standard for pregnant women in nuclear industry was respected for years. And now there are pregnant women in Fukushima or other contaminated areas, and also infants, babies, toddlers, children who are living in area which is a lot higher than the national standard before which was established before the March 11th.